Hello, thank you for coming today. Welcome to our discussion of cannabis for the treatment of human sexuality. I'm Dr. Jordan Tishler. I'm president of the Association of Cannabinoid Specialists, and we're honored to be able to be part of today's events. I'm also faculty at Harvard Medical School, and I run my own practice, which is called Inhale MD, in which I treat patients exclusively with cannabinoid medicines, and I have particular interest in human sexuality. In today's presentation, we're going to focus particularly on female orgasmic disorder. This is an issue for women with prevalence ranging from 10 to 42%, depending upon a number of factors. It's clearly a major public health issue for which there are few therapeutic options. Presentation today will be given by my graduate student, Suzanne Mulvehill, and she will talk about some exciting data about using cannabis as a treatment for female orgasmic disorder. Thank you.
Thank you, Dr. Tishler, for the introduction. My name is Suzanne Mulvehill. I'm a PhD student at the International Institute of Clinical Sexology in Miami Shores, Florida, and I'm conducting research on cannabis as a possible treatment for female orgasmic disorder. I'm doing a dissertation on that and collecting data currently at my nonprofit. I also direct a nonprofit called the Orgasm Project, and the website is called at www.orgasmproject.org. So I'd like to share with you my poster presentation. I'm going to share the screen with you now. This research is titled 3 Theories Explore Why Women Who Use Cannabis Regularly Are Twice as Likely to Orgasm. And I'd like to highlight that word regularly. Or more frequently, because that word was found in the research, not just in this particular piece of research that I'm going to talk about, but in prior research as well, other research as well, that the frequency of use has been tied to, we're going to, in this particular situation, talk about why women are twice as likely to orgasm. So to give you some background or introduction to this research, Dr. Becky Lin did research in 2019 that highlighted women who used cannabis more regularly were found to be 2.13 times more likely to orgasm. So with that research, which I use that research as the basis for the theories that I developed to explore why are women who use cannabis more regularly 2.13 times more likely to orgasm. And if we take a look at the fact that up to 41% of women have female orgasmic disorder or difficulty orgasming. So I'd like to take a moment and go over with you like the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, what female orgasmic disorder basically means. Distress, that a woman who is experiencing distress in her inability to orgasm or not experience fulfilling orgasms, not orgasm at all. So the categories are basically, there's 3 categories. There's primary orgasmic disorder, which means also is called anorgasmia, and means that a woman has never orgasmed in her life. That's primary orgasmic disorder. And then secondary orgasmic disorder means that a woman used to be able to orgasm, but cannot any longer. And for example, pharmaceutical drugs have been shown to cause secondary female orgasmic disorder. I want to make a point here that secondary female orgasmic disorder in the 80s meant something differently. It meant something different in that secondary female orgasmic disorder, if you look back in the research in the 80s, it basically meant women who could not have vaginal orgasm. So I think it's important to identify that. I mean, I researched more than 900 articles for my dissertation, and that stood out to me as something that's important to recognize. And the third category is situational orgasmic disorder. So situational orgasmic disorder is when a woman can orgasm in one situation, but not another. For example, she may be able to orgasm through masturbation, but not with partnered sex. So that would be considered situational orgasmic disorder. And that category of orgasmic disorder is the highest. So I'd like to talk with you a little bit in this introduction about the treatments for female orgasmic disorder. And the reason I'm highlighting this is because we'll begin to understand the necessity for additional treatments for female orgasmic disorder. So up to 41%, and some research says up to 46% of women have difficulty orgasming. And Dr. Osmo Kontula, a researcher in Finland who's done research for more than 30 years on female orgasmic disorder, has found that the statistics haven't changed for more than 50 years of women who have difficulty orgasming, despite the enhancements in sex therapy and even women's masturbation, like women's sexuality, the freeing up of women's liberation. I guess we could use that as a terminology as well. But the important thing is the statistic has not changed in more than 50 years. So, and if we tie that to the fact that there is only one validated treatment for female orgasmic disorder that was developed in the 1970s, that treatment is called directed masturbation. And that particular treatment program is only for women who've never orgasmed. So that leaves out women who have secondary orgasmic disorder, women who, as I shared with you, may have orgasmed in the past, but are not any longer, perhaps because also of trauma, and also women who have situational orgasmic disorder, that there is no validated treatment for these women. Okay, so the methods of gathering this research on the three theories that explore why women who use cannabis regularly are twice as likely to orgasm was done through a literature review using PubMed and a number of other databases. I had collected much of this data, as I shared with you, for my dissertation proposal and for the research. So the first theory I'd like to share with you is what's called the altered state of consciousness theory. So cannabis has been found to alter consciousness. The THC in the cannabis has been found to alter consciousness. And the altered state of consciousness theory proposes that women who, see if I can make this all fit into one screen, which I cannot. Women who are used to being induced into an altered state of consciousness, if we keep in mind this concept of frequency of use or use of cannabis regularly as to it being a facilitator for why women who use cannabis more frequently are more than twice as likely to orgasm, that they are familiar with slipping into an altered state of consciousness. So that's the altered state of consciousness theory that hypothesizes why women who use cannabis more frequently are twice as likely to orgasm. And the altered state of consciousness has also been found to facilitate. Dr. Costa had found research that women are more likely, altered states of consciousness were found to be strongly related to higher sexual responsiveness in women. So there's a correlation there between an altered state of consciousness and higher sexual responsiveness in women. The second theory is called the state of absorption theory. Dr. Schwartz back in 1994 found that women need to be in an altered state of consciousness, in an absorbed state of consciousness to orgasm. And an absorbed state of consciousness is an intense focus on bodily sensations, for example, and or imagination. And both bodily sensations and fantasy and or imagination are stimulated through the use of cannabis. So the research concludes that a state of absorption or the state of absorption theory hypothesizes that this absorption state, which is essential for higher sexual arousal in an orgasm, can be stimulated with cannabis. The third finding is called the amygdala reduction theory. And the amygdala reduction theory proposes that cannabis has been shown to reduce activity in the amygdala, in the part of the brain that is related to hypervigilance and cognitive distraction. For example, cognitive distraction is one of the main reasons why women have reported having difficulty orgasming, is that their mind is wandering, they're thinking about different things while they're having solo or partnered sex. So with the mind wandering, they're distracted. So being that cannabis reduces the activity in the amygdala, the part of the brain that is hypervigilant, or that alerts a woman, for example, also to anxiety, this theory proposes that a reduction in the anxiety that is related to the reduction in the activity in the amygdala can facilitate a greater sexual responsiveness and orgasm in women. So those are the three theories that I developed with backings of research to show that potentially if we were to look at the, a conclusion is that it's hypothesized that women who use cannabis more regularly may be more comfortable with altered states of consciousness and may be more easily able to be in an absorbed state of consciousness, meaning focused on bodily sensations and being able to be in her imagination and in fantasy, and also through the activity in the amygdala being reduced, where the hypervigilance is inactive, the cognitive distraction is reduced, that a woman is more likely to orgasm. So my research is proposing that there has been no research, basically, that in a literature review discovered that there had not been any research that exclusively looks at cannabis and women who may use it who have difficulty orgasming. So that is what my research is. I'm collecting data on that. And if you'd like to share the survey, it's online. You can access it at orgasmproject.org and go to our research. It's at the bottom of this screen. I'll scroll down here. Here you'll see orgasmproject.org. You can also reach me at info@orgasmproject.org if you have any questions. And I'd like to thank you very much for the time that you've taken to listen to my presentation. And thank you, Dr. Tishler. And I appreciate it very much. Thanks so much.